If you're a man with ADHD and you're dealing with brain fog, low drive, and fatigue, even though you're doing all the right things, this video is for you. Maybe you're on medication, or maybe your doctor has told you that your labs are normal, but you still feel tired, unfocused, and just not like yourself. One piece that's often missing in this conversation is testosterone. Low testosterone doesn't just affect sex drive. It can have a major impact on your energy, on your mood, and on cognitive function. And for a lot of men with ADHD, that can overlap and can make it really hard to tell what's ADHD and what's actually a hormone issue. I'm Dr. Dan Sullivan. I'm a naturopathic doctor, and I'm also certified in functional medicine. I work extensively with patients with ADHD, mood concerns, and hormone imbalances, and I run lab testing on almost every patient I see. In this video, I want to walk you through how low testosterone can contribute to brain fog and low motivation in men with ADHD, what I look for on labs, and how I start thinking about treatment from a foundational root cause perspective. Let's start with what testosterone actually does in the brain. Testosterone is often thought of as a sex hormone, but it's much more than that. We have androgen receptors throughout the brain, including the frontal lobes, the part of the brain responsible for planning, organization, impulse control, and working memory. Those are all areas that are already challenged in ADHD. The frontal lobe relies heavily on dopamine to do its job. Dopamine is one of the main neurotransmitters involved in focus, motivation, and the ability to stick with a task long enough to actually finish it. Testosterone helps support this system by influencing how much dopamine is produced, how sensitive the receptors are, and how effectively those signals are transmitted in key circuits between the frontal lobe and deeper brain structures. When testosterone is in a healthy, optimal range, those dopamine pathways in the frontal lobe tend to function more efficiently. Effort feels more rewarding, it's easier to get started on tasks, to stay engaged, and to feel a sense of drive and follow through. When testosterone is low or suboptimal, those same circuits can feel like they're running on a very weak signal. A lot of men describe the same cluster of symptoms, like I feel flat, I can't get myself to start things, my brain feels dull, I'm more irritable, I just don't feel like me. That's not just a willpower problem, it's a reflection of how hormones and dopamine are interacting in the frontal lobe. So if you already have ADHD and your frontal lobe and dopamine system are working harder to begin with, adding low testosterone on top of that can magnify the problems with focus, with motivation, and with follow through. So why do I see low or suboptimal testosterone so often in men with ADHD? There's a few big reasons for this. First, chronic stress. Many men with ADHD spend years in a state of always behind, constantly trying to catch up, overworking, and running on adrenaline. Chronic psychological stress raises cortisol, and over time, that can suppress the hypothalamic pituitary gonadal axis, the system that tells your body to make testosterone. Second is sleep. Sleep issues are very common in ADHD. Trouble falling asleep, staying asleep, or keeping a regular sleep schedule all impact hormone health significantly. Most testosterone in men is produced during deep sleep. If you're chronically sleep deprived, testosterone almost always suffers. Third are lifestyle patterns. Irregular eating, blood sugar swings, high caffeine intake, more screen time at night, and sometimes higher alcohol use all show up more frequently in my ADHD population. These factors can contribute to weight gain, insulin resistance, and increased inflammation, all of which can lower testosterone. Fourth are medications and coexisting conditions. This is a bit more nuanced, but things like long-term stimulant use, SSRIs, metabolic issues, and other chronic health problems can indirectly impact hormones by changing sleep, appetite, and stress physiology. So you can understand this picture where a man has ADHD, is under chronic stress, is sleeping poorly, and may be carrying extra weight or dealing with blood sugar issues, and his testosterone quietly drifts downward. He may still be technically in range on a basic lab test, but nowhere near optimal for how he feels and functions. That leads us to the lab work that I look at. Most men who come to see me and say my testosterone was checked have only had total testosterone measured. Sometimes that's a fasting morning sample, sometimes it's not, and often the lab range is extremely broad. When I'm evaluating hormones in a man with ADHD, I'm usually looking at a much more complete picture. I'll look at total testosterone, free testosterone, I'll check sex hormone binding globulin or SHBG. I'll also run LH and FSH or luteinizing hormone and follicle stimulating hormone to see how the brain is signaling to the testes. I'll often look at DHT or dihydrotestosterone, which is a more potent metabolite of testosterone. I'll check estradiol to see how much testosterone is being converted into estrogen. And I'll look at PSA as well to keep an eye on prostate health, especially if we're considering any kind of testosterone raising therapy. Aromatization is the process where your body converts testosterone into estradiol using an enzyme called aromatase. That enzyme activity tends to go up with higher levels of body fat and higher levels of inflammation. So if a man has extra weight around the midsection and systemic inflammation, he's often converting more of his testosterone into estrogen. So if a man has extra weight around the midsection and systemic inflammation, he's often converting more of his testosterone into estrogen. On labs, that can look like lower effective testosterone, higher estradiol, and symptoms like low drive, low mood, and sometimes more irritability or emotional volatility. Total testosterone tells you how much testosterone is in circulation overall. Free testosterone tells you how much is actually available to the tissue. Sex hormone binding globulin binds testosterone and can make a man look normal on total T while his free T is low because too much is bound up. Estradiol and DHT help me understand where that testosterone is going and how it's being metabolized once it's made. Here's one of the big problems with how testosterone labs are interpreted. Typical reference ranges for total testosterone are often somewhere around 300 to 900 nanograms per deciliter, sometimes even wider. So if you're at 320, you're considered normal. And if you're at 850, you're also considered normal. The way I explain this to patients is with a car analogy. Imagine somebody tells you anything between 300 horsepower and 900 horsepower counts as a normal sports car. Technically that's true, but a 300 horsepower and a 900 horsepower car are completely different experiences. Testosterone works the same way. Being barely above the cutoff is not the same as being in the upper half or upper third of the range, especially for a relatively young man with significant symptoms. In my clinical experience, most men feel their best when their total testosterone is somewhere in the range of about 700 to 1100 nanograms per deciliter, sometimes even a bit higher depending on the individual and how they metabolize hormones. I'm also paying close attention to free testosterone. As a rough rule of thumb, I like to see free testosterone at least 2% of total testosterone. It's very common for me to see a man with ADHD who has total testosterone in the low normal range, but free testosterone that's clearly suboptimal. On paper, he's technically normal. In real life, he feels tired, unfocused, and unmotivated. For me, that's where functional thinking comes in. I'm not just asking, is this in range? I'm asking, is this optimal for this person with these symptoms at this age? Now, before we talk about treatment, I want to be clear. Jumping straight to testosterone replacement without addressing the foundations is almost always a mistake. Even if a man eventually needs TRT or testosterone replacement therapy, the basics still matter, and they're often enough to move the needle substantially on their own. So what are those foundations? Number one is sleep. Getting consistent, high-quality sleep is non-negotiable for hormone health. That means aiming for a regular sleep-wake cycle, reducing late-night screens, and supporting your circadian rhythm. For some men, that also means addressing sleep apnea or other sleep disorders. Number two is stress. Chronic, unrelenting stress is a testosterone killer. I'm not just talking about a rough week, I'm talking about years of running in survival mode. We work on nervous system regulation, breathing practices, boundaries, and sometimes therapy or coaching to help get the body out of fight or flight. Number three is blood sugar and nutrition. Frequent blood sugar spikes and crashes put stress on the body and contribute to inflammation and insulin resistance. I'm looking at protein intake, overall nutrient density, healthy fats, and fiber. We want stable blood sugar, not big swings that leave you crashing in the afternoon. Number four is movement, and specifically weight training. Resistance training is one of the most powerful lifestyle tools we have for supporting testosterone. You don't have to live in the gym, but regularly challenging your muscles sends a very clear signal to your body that it needs to maintain strength, lean mass, and hormonal support. Even 2 to 3 strength sessions per week can make a meaningful difference over time. Number five is reducing obvious hormone disruptors. That might mean cutting back on alcohol, being mindful of nicotine or vaping patterns, and paying some attention to environmental exposures where it's realistic to do so. Once we've addressed these foundations, there are still men who have persistent low testosterone, clear symptoms, and a meaningful impact on their quality of life. That's when I start talking about more targeted options. There's several tools we can use to support testosterone production without jumping immediately to full-on testosterone replacement therapy. For some men, I'll use medications like HCG, which stimulates the testes directly, or enclomiphene, which helps the brain send a stronger signal to make more of your own testosterone. In the right context, these can be used as standalone strategies to optimize testosterone while preserving fertility and maintaining the body's own production. For other men, especially when testosterone is very low and symptoms are significantly impacting quality of life, we do end up using TRT, testosterone replacement therapy, through a structured, medically supervised program. That's something I do in my practice when it's clearly indicated and always with proper monitoring of labs, symptoms, and long-term risk. The key point is that if you're a man with ADHD who has significant brain fog, low motivation, and low drive, and you've never had a proper hormone evaluation, or you've only been told your testosterone is normal without any real discussion, it's definitely worth a deeper look. Testosterone isn't the only factor in ADHD, and it's also not a magic fix. But when it's low or suboptimal, it can absolutely amplify the challenges you're already dealing with. Addressing it can make it much easier for your brain to respond to the other strategies you're using, whether that's medication, coaching, therapy, or lifestyle change. So to summarize, low testosterone can show up as brain fog, low drive, low mood, and fatigue, symptoms that often overlap with ADHD. Men with ADHD are at higher risk for suboptimal testosterone because of chronic stress, sleep issues, blood sugar problems, lifestyle factors, and sometimes medications. A quick total testosterone check is often not enough. We need to look at free testosterone, sex hormone binding globulin, LH and FSH, DHT, estradiol, PSA, and the broader hormonal and metabolic picture. Most men tend to feel better when total testosterone is closer to the upper half of the range, often in that roughly 700 to 1100 nanogram per deciliter zone, with free testosterone at least around 2% of total. Foundations like sleep, stress management, nutrition, weight training, and reducing hormone disruptors are essential, whether or not you end up ever needing medications like HCG, enclomiphene, or TRT. These are not standalone solutions for ADHD, and they don't replace comprehensive medical care. But when we address both the brain and the hormones, the results are often much more powerful and sustainable. If you're listening to this and thinking, that sounds like me, bring this up with your doctor or another qualified healthcare provider who understands both ADHD and hormone health. Ask for a more complete hormone workup, not just a quick glance at total testosterone. If you'd like to work with me one-on-one to address ADHD and hormone health from a functional and naturopathic perspective, and to look more deeply at your hormones, your nervous system, and your labs, you can use the link in the description to set up a discovery call. And if you found this video helpful, you're welcome to subscribe for more videos on ADHD, hormones, gut health, and natural mental health. The information in this video is for educational purposes only and is not medical advice. It does not diagnose, treat, cure, or prevent any condition. Do not start, stop, or change any medication, hormone therapy, or supplement without speaking to your own doctor or qualified healthcare provider.